Now, it is my pleasure to introduce Dr. Esther Diana Rossi, a pathology professor from Catholic University, Rome, Italy. And her talk is entitled The Story of Large Eosinophilic Cell, What's in a Name? The True Hurtle Cell Identity.
Good evening and good afternoon. Thank you so much for this invitation. It's really my pleasure. And I have to tell you that I was very happy to prepare this talk because it was a journey in the knowledge of, the history also, as you will see. So the story of large eosinophilic cells, what's in the name? The true Hurtle identity. I do not have any conflict for the Melad with Esther and the different W2. I'm really keen on liberal art movies, so you will see several references in it. And I would like to start with this, the story of a maze name identity, because it is what we will see. And also with William Shakespeare, what's in a name? That which we call a rose by any other name would smell as sweet, because it's different things that will have the same wrong, we have to say, identification. And of course, there is also the opposite, like the Pantheon, the same name for at least two different places. The first was in Rome, built it by Agrippa, 27 before Christ. The second, and very large, was in Paris during the French Revolution, 1789. The reference to this topic is also from this article on the oncologist endocrinology, the significance of Hurtle cells in thyroid disease by Jennifer Cannon from North Carolina. And we have, of course, to go back to the future, the trilogy with Michael J. Fox. But if you prefer Woody Allen, The Midnight in Paris, telling the story of a screenwriter and novelist who traveled back to the past in 1920 every evening at midnight in Paris, of course. We have to focus in the 1894, what was happening in the world in that year, of course, some of the events. On the right, you can see the invention of the cinematography by the Lumiere brother. If you are going to Lyon, there is an amazing museum because they were born there. In the US, you have the Yellow Kid who started the comics. In the upper right, you can see the first car competition, the Paris-Rouen, and you can see the car. This is an original picture, and the reference in the local journal, Le Petit Journal. And also the first International Olympic Committee by Pierre de Coubertin in La Sorbonne. But we have to focus to what was happening in the meantime in Germany. And this is a map of Germany at the end of the 19th century. And of course, Germany, as you know, is big and very amazing city. But we are going to focus on the south, Louisburg, close to Stuttgart and Munich. In the upper right, you can see a picture of the palace and cathedral at the end of the 19th century. And in the right bottom, you can see the cathedral with the Christmas street market nowadays. Why this city? Because Karl Hurtle was born in Louisburg on March 16, 1860. He was a German physiologist and histologist, and you can see a very typical picture from his age. And also just a focus on him, and also to the cells that we are going to refer from the article in the 1894. From Wikipedia, we can have some information about Hurtle. Who was he? Hurtle is remembered for the contribution in the field of hemodynamics. He performed extensive research involving blood pressure, blood viscosity, intracranial circulation, blood supply of organs, vasodilatation, and also introduced a phenomenon called Wien-Kessel effect. Sorry for my try to translate, to use the German language. And in this type of phenomenon, he wanted to demonstrate the importance of maintaining a stable pressure. But he also studied the motion phenomena of the arterial vascular wall, and also studied for the striated muscle. And last but not least, he studied the function and morphology of the thyroid gland. Specifically, what he found was a type of cell which was large, granular, eosinophilic, and He referred to this as a follicular cell called, after his name, Hurtle cell. But is the correct attribution of something like the Salvator Mundi? On the left, you can see the oil paint that was presented during an exhibition in the National Gallery in London, 2011, and attributed to Leonardo da Vinci, according to the fact that some hardy critics show its similarities concerning the lips with the La Gioconda, and also the intensity of the color of the dress. But according to other critics, this is not a Leonardo da Vinci painting, because it is motionless and also a very frontal appearance of the face. In 2020 was found in Lombardia this sanguine drawing, attributed for sure to Leonardo da Vinci, according also to some of his papers, in which he referred to this sanguine drawing as the real Salvator Mundi. So the question is open. And in some way, it's like the problem that we had with what Hurtle discovered, because what he described, according to him, was an intrafollicular cell of the thyroid found in the normal canine on dogs. We can say that he acknowledged this physiologist, Weber, who firstly found the same type of cell in other laboratory animals, and they reported this in the paper published in 1894. So thinking that this was, of course, a type of follicular cell. But what he discovered was not the follicular cell or oncocytes, as he thought, but the parafollicular cells. And we will see from the picture, it's a very slight difference, like the difference that, I don't know if you think about that, turtle, which mostly live in the water, and tortoise, who dwell on the land, or cupcake with icing, or muffins without. And in fact, this is the parafollicular cells that you can see surround, of course, as we know, the follicular cells, and we might have this a little bit enlarged, a little bit eosinophilic cytoplasm, which is exactly from the picture on the right, the cells that he described. 4 years later, in 1898, the cells known as Hurtle cells, so the correct oncocyte cells, was firstly described by Max Ashkenazi, who noticed this type of cells in a patient with Graves' disease. Max Ashkenazi was a German-Swiss pathologist. He contributed to the field of hematology, parasitology, also important study for the bone pathology and the formation, of course, of tumor in humans. In the 1898, he was the first to describe the Hurtle cells, and in 1904, he found the link between parathyroid tumor and also the osteitis. But it's also important because in 1921, he described for the first time the Schaumann bodies, and 2 years later, he was the first who described the gastric carcinoid tumor. So only Hurtle and Ashkenazi like the difference between llama and alpaca. If you don't look at the picture, you think that they are pretty similar, but they are not. We are wrong, because alpaca are smaller, more consistent, with a very soft and very expensive wool, and mostly very shy and meek comparing with the llama. But we have to go on, because the difference is not like only llama and alpaca. And we have to arrive to James Ewing, which was an American pathologist. In 1919, he published a very important first edition of Neoplastic Disease, a textbook on tumors. This book was translated in many languages and was a cornerstone for modern oncology by establishing a systematic and comprehensive evaluation of diagnosing human cancer. And 2 years later, he also published a paper dealing with an osteoma that then was the Ewing sarcoma. In this paper, exactly, Ewing described a thyroid carcinoma, which was composed of cells that were described with this finely granular eosinophilic cytoplasm. So he derived the name from Hurtle, and so he confirmed the misnomer and suggested them as hypertrophic Hurtle cells. By the way, 12 years before, Langhans in 1907 described the same tumor discussed by Ewing, composed of a different type of cells comparing with the Hurtle cells, so probably mostly similar to the Ashkenazi cells. So it seems like the story of the man who mistook his wife for a hat, a British Oliver Sacks, a British neurologist, and of course also a writer who used the description of these case studies for the description of the neurological diseases. And I'm really keen on 007, especially Daniel Day Craig, and you can see Quantum of Solace, Skyfall, Spectre, Casino Royale, and No Time to Die. And on the right, you can see Daniel Craig with his identical stuntman during one of the cruel, of course, action. It's something similar for the cells because since 1928, the term Hurtle has been used to the cells described by Ashkenazi. So Daniel Craig and his stuntman working together like these two names. We have to say that, by the way, in German, the cells were referred almost always as Ashkenazi cells in a sort of being proud of that, but also in protest of the misattributed name. We have to arrive to 1931 with two other authors, Ampern introducing the term oncocytes to define a virtually identical cell structure found in the salivary gland, and Welsh had described in the same time of Hurtle this other type of cells in the parathyroid glands of cats, describing and referring these as oxyphilic cells. The term oncocytes is derived from the Greek root onko, which means mass bulk. The term is exactly onkostai, which means swollen or enlarged. And the first description of this was done by Schaeffer in the 1897, describing these eosinophilic cells in the ductal and acinar elements of the salivary gland, but also, of course, in the tongue, in the pharynx and esophagus, as we know that there are more than 100 small salivary glands in the head and neck district, apart from the three major glands. You can see the reference to Hempel on the left and the experiment on the parathyroid of the cats by Walsh. So it seems like The Mystery of the Horizon by Magret in 1955, different men looking at the same horizon from different perspectives. Since then, we have to say that the term Hurtle, Ashkenazi, oncocytes, and oxyphilic cells were widely used interchangeably to define cells displaying similar specific features independently from their anatomic sites. We have to say that, however, the term Hurtle cells was only used to the cells, the follicular wrongly defined cells in the thyroid. Exactly 4 different names. As you know here, these 4 different David's statue. The first and most famous is the one on the left by Michelangelo in the Galleria Accademia in Florence. The second and the third have a younger version of David by Donatello and by Verrocchio, who can be the artistic father of Leonardo da Vinci. The last one is a more masculine David by Bernini in the Galleria Borghese in Rome, but 4 different Davids defining the same concept, of course, of David. What happened in 2022? We had a change because for the movies, we have these Oscar movies, Dune, El Canto, and Encanto as a cartoon, Belfast, The Power of Dog, and Coda. But we have also the 5th edition of the endocrine and neuroendocrine organs. And according to all this story about Hurtle and the parafollicular cells, the follicular cells, Ashkenazi, the 5th edition decided that the term oncocyte is to be used, replacing the wrong attribution of these oncocytic cells as, of course, Hurtle. Just briefly, to be a little more scientific, oncocytes versus follicular, large polygonal cells with these abundant eosinophilic cytoplasms, rich, of course, on mitochondria, enlarged round nuclei, thyroglobulin positive, risk of malignancy 15–45%, lymphatic spread, iodine avidity is poor, and the prognosis is pretty similar to the malignant follicular counterpart. Something similar was also published on endocrine pathology in 2010 by Odzgurmete and Asa, confirming that oxyphilic cells are oncocytes and that oncocytic changes are cellular adaptive process of follicular cells. The changes can be seen in follicular cells and C cells, and the oncocytic changes has its own molecular basis. We might have benign and malignant tumor for the oncocytes, and oncocytes are not a distinct type of cells of tumor, as well as, we might have different subtypes with the oncocytic features. And this is a pretty nice picture of these oncocytes. So it seems that from the mess about all this name and the confusions, we unravel the mess and we arrive to the definition of the core term to use, which is oncocytes. So it seems like this. We move from several past life, an amazing movie candidate to the Oscar in 2021, to this other amazing movie by Anthony Hopkins, One Life. And I really would like to thank all of you for your attention, but mostly before, I need to thank these 5 guys. Without them, I wouldn't have been here to talk with all of you. So Hurtle, Ashkenazi, Ewing, Ample, and Walsh. And of course, all of you for this attention. Thank you so much.
Thank you, Dr. Rossi. Are there any questions from the audience? Yes, please.
Thank you, Diana. Fantastic talk as usual.
Thank you.
I just want to say that maybe we should also clear another mess, which is with the molecular. Some people were saying you need to look for BRAF, you need to look for red PTC. These tumors don't have BRAF, they don't have red PTC. They're all driven by multiple copy number alterations of specific types. It's called genome hybridization type. So now we have one name, and now we have also molecular pathogenesis of this cell. So I think that now, from now on,
maybe another story that we can tell about what happened.
Yeah.
Why not?
Thank you.
Why not?
Any other questions?
I have one. Is it just in Germany that they were referred to Ashkenazi, or is it more widespread in Europe that you didn't use Hurtle cell? And
to be honest, I exactly don't know. But, according to the article, I followed this article, which was very, very, very interesting and very exhaustive in the description. And then, give me the occasion to go to the story of the single person and to enlarge the topic. So according to her, to Jennifer Cannon, this was used specifically Ashkenazi in the German, and they, in a sort of reviewing the use of Hurtle. But I'm really exactly don't have a specific.
Incidentally, in the Soviet Union or Russia in the 80s, we also called them Ashkenazi cells.
Okay, you see.
Because he was from Prussia. So,
okay, maybe.
Yeah.
Okay, thank you.
Okay.
Thank you. Are there
Thank you so
any
much.
questions?
Thank you. And thank you.